Hi, my name is Dr. Pamela Muga, a consultant obstetrician in partnership with Ponea Health, and today we're going to be discussing endometriosis. So endometriosis is a condition where you find the lining of the uterus in places outside the uterus, in places where it's not supposed to be. It can be found in various sites all over the pelvic area, so around the ovaries and the other organs around your pelvis, or even other organs like your lungs, your skin, and other places. The exact cause of endometriosis is not known, but there are theories that it is likely to be caused by back movement of your period. So around the time of your period, a lot of people get the back movement of your period. Instead of it coming out through the cervix, it goes back through the fallopian tubes. This has been noted to happen in about 90% of women, but only about 5 to 10% of women develop endometriosis from that particular disorder. There are some genetic components that might predispose you to getting endometriosis. The commonest symptom of endometriosis is severe pain during your periods. The pain tends to be quite severe, affecting your ability to continue your work or to go to school or to do any of your daily functions. So it's always important that if you get severe pain during your periods that does any of that, then it's good to see a gynecologist. It can also cause other problems. So the pain may spread towards your bowel. You may get severe pain even as you're passing stool. You may get pain during sexual intercourse, so it's always good to have that checked as well. Endometriosis tends to run in families, so you find a situation where if your mom had severe period pain, then you're likely to have it. It can also be from your first degree relatives, so aunties, cousins, that kind of thing. That being said, it being a genetic condition means that it can also sometimes occur spontaneously in different areas, in different families. So endometriosis treatment would ordinarily start with pain control because of that debilitating pain. So most of the time we'd start you on pain medication. It tends to be a condition that is influenced by your hormones. There's too much estrogen and the pain occurs during your period. So we would want to limit the number of periods that you have, and that would call for hormonal treatment. So different methods of hormonal therapy would help us to stop your periods and then stop the pain and allow to prevent the disease from progressing. So diagnosis of endometriosis tends to be difficult, and the gold standard of diagnosis is laparoscopic, which is a surgical procedure, which is not always acceptable to many people. So in terms of diagnosis, then most of the time you'll have a long chat with your gynecologist and they'll be discussing a lot of your symptoms to try and come up with that diagnosis. Most of the time we'll start you on treatment. And if you respond to the treatment, then we tend to continue that without the actual diagnosis. Because for us to diagnose it, we actually have to find that endometrial lining in the wrong place, and that would take surgical intervention. So you find that most people who end up being diagnosed with endometriosis, the diagnosis happens a long time after they've already probably started treatment. The commonest problem that we have with people who have endometriosis is that debilitating pain, so that you're unable to carry out your daily function. So it would take a lot of support, even from your colleagues at work, from your employer, for you to be able to carry on with your activities when you have endometriosis. Another important thing would be fertility. So in patients who have endometriosis, because of that constant bleeding from the lining that's not inside the uterus, then you have a lot of scar tissue formation, and that can lead to infertility. So in supporting your loved one who has endometriosis, then the main thing would be the psychological support, helping them to lead that balanced lifestyle. So doing things like exercise, fluid intake, healthy eating would be important. And then also in terms of encouraging them in terms of the treatment. So the treatments tend to be things that people find socially not acceptable. Things like the hormonal therapy. Most of the time we would end up using contraceptives to modulate the patient's hormones, and a lot of people feel embarrassed about having to take such medication. So probably as a family member, it would be good to encourage them and give them the space maybe to share their experiences with you, and then encourage them to accept some of the medications or treatments that are provided. For some people, the pain may end up becoming chronic. So when you have chronic pain, then that makes it difficult for you. Also, because of that difficulty during your periods, then they tend to be patients who have a lot of anxiety, depressive illnesses. So that general support from the friends, the relatives would be quite good. Fertility is a major issue for people. So just that support when they are going through those issues would be important. Thank you for engaging with us in this episode. You can book my services at ponea.com. I look forward to engaging with you in the future.